People usually think, okay, are we supposed to undress in front of a male gynecologist? So it's not like that. The team would get you prepared. All we see is something in centimeters. And in our mind, what is working is, okay, we have to remove this infection, or we have to control the bleeding, or we have to save the baby and the mother. We have to stitch some tear.
గైనకాలజిస్ట్ అంటే ఎక్కువ శాతం దీసి లేడీస్ ఓన్లీ. సో జెంట్స్ చాలా చాలా రేర్గా చూస్తూ ఉంటాం, చాలా తక్కువగా చూస్తూ ఉంటాం. సో హౌ డస్ ఇట్ ఫీల్ ఫర్ యూ బీయింగ్ అ మేల్ గైనకాలజిస్ట్?
Absolutely. So initially, when I was having an interest in the subject, అంటే ఈ career, ఈ gynecologist అనేది, my father was not supporting me. So he said that ఇప్పుడు తెలంగాణలో చాలా కన్జర్వేటివ్ ఉంటారు, లేడీస్ విల్ ఫీల్ వెరీ షై అండ్ దే విల్ నాట్ కమ్ టు షో అండ్ బట్ బికాస్ ఆ సబ్జెక్ట్లో స్ట్రాంగ్ హోల్డ్ ఉంది, సో ఐ డిడ్ అ లిటిల్ రీసెర్చ్. సో ఇన్ ద కంట్రీ దెర్ ఆర్ మెనీ సక్సెస్ఫుల్ అండ్ leading male gynecologists, and usually they deal with surgical part, so they are experts in gynec surgery anamata, whereas female gynecologists, they are doing both surgeries and deliveries. So whenever there are some crucial steps of the surgery, definitely oka male gynecologist and surgeon unte, it is also a very good addition to the team anma.
ఓకే, ఫస్ట్లో వెన్ యూ స్టార్టెడ్ ప్రాక్టీస్ అది, what was your experience of it?
So when I started my practice, this was 11 years back, and a lot of the women, of course, I started off in a big corporate institute, and there were some of the people, they were very comfortable, but some of them, they were very shy, and especially when when we see the pregnant woman, and we are trying to assess the baby or the scans and check the heartbeat also. There was some conservative couples who they did not like there should be a male gynecologist. Of course, there are some other people who have religious constraints. So but in my career and practice, so I have delivered around 40 to 50 women in a single day.
Wow.
Yes, so we have tremendous experience, and what we look at when we see a patient is we have to ensure the safety of life of mother and baby. So we are not here to think anything other than that. So patient, it's a sacred part of our journey.
Doctor itself, it's a sacred.
It's a sacred journey. Of course, we do take a lot of precautions to ensure privacy of the patient. So when I go to the theater or I go for a procedure, we ensure that there are sufficient number of women in the team who will completely get the things ready, prepared, and the patient will be fully covered. There won't be any exposed areas until and unless, of course, there's a vaginal procedure, we would have to keep a speculum. But then only the medical part which has to be operated. Other than that part, nothing else would be exposed. So there, a lot of the equation will change. If people usually think, okay, are we supposed to undress in front of a male gynecologist? So it's not like that. The team would get you prepared. All we see is something in centimeters, and in our mind, what is working is, okay, we have to remove this infection, or we have to control the bleeding, or we have to save the baby and the mother. We have to stitch some tear. So we are not thinking anything from an abnormal perspective.
Okay.
Yes.